Hello, this is Renee Manfree, and I am with What's Your Passion podcast. And I have a very good guest, friend of mine, Michael Brantmeier, is on with us today. And he is a chiropractor for over 28 years, and he really specializes in different areas of really helping his clients in certain areas of really pain relievement. He has some different things we're going to talk about tonight. So, really, just an opportunity. I thank you very much, Michael, for your time. And we don't know who's going to be watching yet. We're live on 3 or 4 different channels. So this would be a great opportunity where I can just kind of ask a few questions and get to know you a little bit and tell me a little bit about yourself.
All right. Well, thank you, Renee. I appreciate it.
So tell me, you're based out of Metairie, Louisiana, and you've been in a chiropractic. So how did you get into this industry? I mean, were you local school or?
I'm originally from Texas. That's where I was raised, and my training was in Texas at Texas Chiropractic College, around the Houston area. And I started kind of like went into a little bit backwards as far as I was originally going to be a dentist, and some friends of mine were going to chiropractic school or training. We're all doing undergrad together,
Right.
And I started learning more about chiropractic. Oh my God, it's so much of a better fit for me than dentistry. So it's a really good decision. I'm glad I made it. I've been doing it, for at least 28 years now. So it's been a lot of really good success stories, a lot of good years, and very, very happy that I'm part of this profession.
And so I'm sure you're like anything, you have the experience of opportunity bringing people in and they're in pain, whether it's from car accidents or just natural, because I'm 54 and I'm realizing that I have more pain now than ever before in my whole life. Right. So just helping people with that process. I'm sure you get a lot of what am I looking the word for? Just value from that. Right.
Oh, absolutely. Yeah. That's one of the biggest things we do focus on in my clinics, because we have 3 locations around town. The main one's in Metairie. We also have one in New Orleans. We have one on the West Bank as well, which I guess is still considered New Orleans, closer to the Algiers area of General de Gaulle. So, but yeah, we focus mainly on injuries and everything. I've treated everything from athletes to car accidents to people get hurt at work. And then plus people with just general pain, I guess, weekend warrior type athletes as well,
Right.
So some pickleball people, coming in, stuff like that. So, but I have a lot of success with people, and we've been very successful at what we do. So
tell me a little bit about ESWT, which is acoustic shockwave therapy. Is that something that you specialize in for quite a while? I think we're just now talking about that. That's a machine that's in the background.
Yeah, absolutely. Yeah, this is what the machine itself looks like. The this is something that I was doing a lot of research, and I've had this machine for about a year now.
Okay.
And I was reading the research about it. I went ahead and tried it out on myself personally, because I was having a lot of knee pain at the time. And, just by, I guess, being old man that I am. And so had the treatment on my knee, and it was just incredible on how quickly the response I received, from the treatment. It only took me like a couple of treatments to really get out of the pain I was in, because I was suffering for about a good 2-3 weeks, and I was limping and everything. And then after about 1 or 2 treatments myself, it improves so much. And then after the 3rd or 4th treatment, I felt like, I felt pretty good, but, I went ahead and just stuck it out and finished the protocol. And this is like about a year ago, and I haven't had knee pain since. So it's been pretty incredible for me personally. But I've seen some of the results with a lot of patients that have been coming in the past year that have had this treatment. So it's been pretty exciting to bring this treatment on, because I've used so many different modalities through my practice years.
Right.
And this is something like I've never seen. I've used a little muscle tone machine, and that gives good results. Everything's got has benefits.
Right.
But to get something like quickly and more long lasting and permanent results, this is a machine that is really, blows me away. And I mean, I'm surprised every time I use it on a new patient, see the results I get from it, because it's like, and they're amazed too, because they go, oh my God, I've tried all sorts of different things, and to get a response this quickly, for healing, is such a, and get out of the pain is a really impressive thing.
So what does it work? What does it work on? Like back pain, and so you said knee, but it works on different types of parts of the body, or what's like if you have back pain, if you have lower back or shoulder stuff like that, is that help in those areas?
Right. Oh, absolutely. Well, the machine itself, the larger joints like the knee and the shoulder, I mean, it has incredible response to, and those are a lot tougher joints to treat,
Right.
In general. But also, I mean, I've worked with wrists, I've worked with ankles, I've worked with plantar fasciitis, I've worked with any of the spine complaints like your neck pain, your mid back pain, your low back pain. I mean, it works with just about everything, and there's a protocol for every area depending on what you're trying to accomplish.
So what do most clients come to you? They come to you from like personal injury attorneys sometimes, or they come to you just from referrals, or what's some of the clients you've gotten through the years?
Yeah, mainly a lot of injury work for sure. I mean, a lot of the attorneys will send to us as well.
Right.
I'm not doing this machine so much for personal injury. I have used it for personal injury before, and I still use it, for personal injury clients. But this is a machine. Yeah, I say more people, just more the weekend warrior type people coming in. Like the average person is like, man, I've been suffering with a shoulder complaint, for so long, or I went to my, doctor. He wants to do all these injections on me, or possibly surgery. I don't know if I want to do that just yet. I wanted to see if I could try, another option. And so, I mean, it really fills that gap, because, I mean, a lot of times patients just don't want to have needles stuck in them. They don't want to go through the surgery, and they would rather do something else, or they're tired of taking pain meds for, 3-4 months. They would rather see if they could do something else, in the meantime, to see if that would help them avoid all that kind of stuff.
So is the acoustic shockwave therapy the same thing as a STEMWAVE machine, or is that two different things?
No, it's a type of therapy that this machine performs.
Okay.
This is a relatively new type of treatment coming around. It's all over the country.
Okay.
And the STEMWAVE company is where I purchased this machine through, but there's also a SHOCKWAVE machine that does similar work as well. And then there's like another therapy called radial shock therapy, which is, it's still a good therapy, but it's not as powerful as this type of therapy. I mean, for some reason, the STEMWAVE and the SHOCKWAVE, they really have it honed down. They have the most treatment benefit as far as, amount of energy that's put in at a time. So that's one reason why I went with this type of system.
And is that covered by insurance, or is it individual that they have to pay out of pocket, or how does that work?
Yeah, unfortunately, at this time, it's not covered by insurance, unfortunately. Right. But right now, I have the initial visit when people come in. I call it a mapping session, and that's kind of we see if this treatment is going to be a good fit for you. Right. So patient would come in, and let's say if I'm going to treat their knee, patient would come in, and I would, essentially give a treatment, but it's called more of a mapping. So it's more of like, okay, let's see what areas, would give me like a little bit more response than others. And because what this machine has is called a cellular response, which is more like a biofeedback. So basically, I'm communicating with the patient as I'm running the wand over each area, and if the area really fires up, I guess you feel a little bit more discomfort in that area where I'm hitting, because sometimes you won't feel much of anything, but when you really hit an area that's really damaged, that's the areas that we want to treat. So I kind of document that down, and that's the areas that we're gonna focus on in subsequent treatments in the future.
And how long does a session take, I guess?
The session's pretty quick. I mean, it's more of just, patient gowning up and stuff like that takes a lot longer. I would say average session's about 4 minutes total. And we're putting about, 400, 4 to 800 waves in, pulses in per treatment. So which gives a really good treatment response. And then I was had an average to get if somebody had a chronic problem, about 10 treatments usually take care of the problem. If it was more of an acute problem, usually a lot less, like maybe 5-6 treatments for more of an acute problem.
Okay.
So that's kind of that's kind of what the guidelines we go by on this.
So does your clinic, do y'all have like different, it's a regular chiropractic clinic that you have like different machines people come in and kind of lay down on and things of that nature in addition to this, or is it, what other services do you have at your location?
Yeah, we have a basic injury treatment center. We have a couple medical doctors that work with us as well. We actually have orthopedics surgeons coming in. He's going to be doing some injections in the probably next couple of months. We have a full weight room where we focus on different types of physical therapy type stuff. And we also have the traditional stuff like the muscle stim machines. We have the heat packs and all that kind of stuff too as well. And then obviously chiropractic adjustments, we do as well. So we offer a wide variety of different things.
So do you sometimes need to have a chiropractic help you with all the work you do on other people?
No, absolutely. Yeah. Well, one good thing that makes me lucky is one of my classmates I graduated with in 1997, we partnered up in 2008 together, and we've had this company, Louisiana Rehabilitation and Spine, since 2008. So he's a chiropractor, I'm a chiropractor, and we've been working together since then. So we definitely treat each other. He'll come up to me, hey man, I did something this weekend, because he takes jujitsu and he's in a lot of MMA type stuff, and of course he's always getting injured. So
what's his name?
Dr. Galvan, Juan Galvan.
Yeah, no, I never met him. Okay, all right, I never met him before.
Yeah, plus we speak Spanish. Yeah, he speaks Spanish. I don't speak Spanish much.
Oh, that helps.
Yeah. So we do offer that in this area too, which it's nice to. A lot of the staff speak Spanish, so we do cater to Spanish speaking community as well.
Especially in this area, it's I think we've grown, especially Kenner area, but I know in general we've grown a lot.
Oh, absolutely, yeah. I've noticed that since Katrina, big influx. The workers came in to help redevelop the area since Katrina destroyed everything. And a lot of the workers came and they brought their families and they stayed. So that's kind of really changed the demographics of the city quite a bit. More towards the Spanish speaking community.
So you were featured on Forbes, The Guardian. Is that correct? Were you featured on some of those?
I don't think. No.
Oh, okay. I might be reading. So when you look at the treatment experience, I guess. So when these clients come in and they're in these states, because I've gone to a chiropractor through the years, and sometimes it lasts for a period of time. But I know as you get, so I haven't stayed consistent. So do you recommend when clients come in that they just kind of start seeing you and you kind of put them on a schedule over a course period of time of what you're feeling that they're getting better in certain areas? And then you kind of, how's that work with most clients?
Oh yeah, absolutely. Well, when somebody comes in, obviously everything is going to be custom to that, person.
Right.
We don't have a cookie cutter approach. I mean, so once we see exactly what stage the person's in, whether it be more of acute injury or chronic injury, or, a lot of it's going to depend on the patient goals or what the goals the patient has, what they're trying to accomplish, whether it's just to get out of pain or whether it's to, have more of comprehensive plan of where we're going to really change our lifestyle. I mean, it's variable depending on the patient, depending on goals and what they're trying to accomplish and everything like that. So.
No, and when it comes down like hip, I mean, it's like I know I've noticed that I used to be in the health club business years ago, right? And so I didn't really have too much pain. And over the course of the last few years, because I'm sitting down, I'm on a computer more, I'm noticing that the neck, you got to pay attention to the neck going forward. And I'm noticing more and more that when I'm looking in the mirror, even that you really have to pay attention to that. Is that what you help people understand that, or help them get into some adjustments to where they can start really straightening out the neck and the back, and it all kind of comes down from the hips? Is that how it all works?
Well, right. I mean, lifestyle changes are very important, because if you don't change some bad habits, you're obviously going to keep getting the same problem over and over. So yeah, we could initially, give an adjustment. We could work on some stretches. We could get you back, to where you should be. But unless you really incorporate some lifestyle changes, it's just going to come back eventually. And then also there's nutritional things we could discuss as well, because one thing that I've worked with a lot of patients on is diet, nutrition, and if especially if somebody might have a little more of a weight issue, get a little more weight off of them, that could be helpful to correcting their problem as well, whether they have a knee problem or a low back problem.
Right.
The reduction of weight obviously would help, preventing further episodes down the road. So
you pretty much like a whole holisticals. You kind of help everybody with certain things, and you give them some guidance, and I'm sure you have some supplements and things of that nature you help them with at your facility.
I don't currently sell any supplements. I mean, I used to,
okay,
a long time ago, but there's a place that's a couple blocks away from me that I recommend they go to. Mm-hmm. And I mean, I'm not affiliated with them. I make no profit, but I know they do good work, and I let them handle it. I just send them over there, and I might make a few recommendations of what they should be getting in their diet, and write it down, and they could just bring it over there, and the Jamie over there will help them out at Queso's pharmacy, a couple blocks away. So that's kind of where I send my patients for nutritional guidance over there, and they're pretty good about counseling and helping people too, as far as that goes as well. So
anything else that you feel that y'all's clinic specializes in that you want people to know about when they're thinking about coming to you, or is there anything out that y'all do besides just like the STEMWAVE, or certain things that y'all emphasize on?
No, that's pretty much it. I mean, I think I covered everything, kind of what we do here, in our biggest focus group. As far as, I mean, when somebody comes to us, we pretty much have a full treatment facility, especially if somebody's been injured, if attorney is working with us,
right?
They can send them to us, we're going to have the medical doctor here for them to give them the medications if they need it, and get a medical evaluation as well. We also work with a bunch of different specialists. So if somebody needs a little bit more than, let's say we try the therapy for a while, it's just not working out, we get an MRI on them, and we see something there that they might need a specialist for at least for a consult.
Right.
Somebody goes a little further down, possibly needs some injections, stuff like that. So I mean, we pretty much have a pretty good little network here that kind of can streamline patients a lot quicker without having to wait long periods of time to get in to see this, get an MRI, get all this kind of stuff, see whatever specialist. So we pretty much have a pretty good little system here going. But I guess the main purpose of why I want to talk about this today is really promote this new machine that I've had for about a year now, that I've seen some really good results with, and that would prevent people a lot of times from getting injections or all that kind of stuff. So
I guess the impulses it goes into, and it just helps relieve either inflammation and things of that nature. Is that what it pretty much does? It just kind of pulses into the system, and how does that really work in there?
Well, the science behind it is this. So what it's doing is sending an acoustic wave down, and it penetrates up to 12 centimeters, depending on the intensity I set it at. So obviously, like if you're working on a wrist or a smaller joint, you're not going to need that kind of intensity. But if you work on something a little bit bigger, you need a little bit more to really penetrate deeply. And what it's going to do, it's going to stimulate. Excuse me, I'm gonna get a little drink of water. It's going to stimulate cells. A lot of times, when you have a chronic injury, you have cells that are just kind of sitting there. They haven't been doing anything, because they're called dormant cells. So what it's going to do is going to stimulate these dormant cells to release neurotransmitters and different things to help out with the healing process. And it even has an effect on the stem cells as well. So it's really going to kick that, healing process into overdrive. And again, ultimately, the human body does the work. We're just enabling the human body. We're waking it up, basically, enabling it for these areas to do the work, to help, break down different things, relieve some of that inflammation that's in there, which ultimately is going to help with the pain. And also it's going to bring in the healing factors to get rid of any damaged cells that might be there, and start regenerating some new cell growth, which is what's needed, and basically put that joint back together the way it should be.
Interesting. I know I've been hearing a lot about stem cells through the last few years. I've been hearing a lot about certain different opportunity. I haven't heard about your type of machine before, but it's been very interesting just hearing more about how the cells kind of die and where they get older, and certain things are just kind of like you're saying, it just kind of helps kind of get it revived, I guess, again.
Well, absolutely, yes. Well, I mean, they say the human body regenerates itself about every 7 years. So every 7 years, the cells you had in your body, for the most part, you're gonna have some new cells. So when you have like a degenerative process, some of those cells aren't really, they're just not able to work the way they should. So this kind of like helps stimulate the cells to get them working the way they should again.
Okay. Very interesting. So if people want to learn more about you or the program or anything, they just reach out to you by phone. Y'all set up an appointment to come by?
Okay. Yeah, absolutely. They can contact. We have a Facebook page, Louisiana Rehabilitation and Spine. Also, they can contact my phone number or the office phone number, and whatever questions are needed, we can help out with. And if they want to come in just for a consultation, right now I'm having it's usually a $49 for the first visit. I'm having a $20 December special right now. So, I mean, I think $20 is pretty cheap. Come in and actually get the machine on you, see how the machine feels, and talk about whatever condition you may be having, and see if the machine be a good fit for you. I mean, it's pretty much of a low commitment. I mean, you just come in, pay the $20, and see if it's going to work or not. See if you're happy with it. If we could do something for you, great. And if not, no harm, no foul. That's kind of the way we work with it.
So that's Louisiana Rehabilitation
And Spine. Yeah, Spine Institute, LLC. We're at 3939 Veterans Memorial Boulevard, Suite 214, right above Prian's Pool Boys. But on the opposite side, because there's driver's license plates right above them. But so we're on the opposite end of the.
So if anybody's familiar with Veterans Boulevard and Clearing, and Prian's is right there. I know in between Cleary and Clearview, before you get to the, I think it used to be like the Boulevard, right? The Boulevard.
Right. Yeah, we're definitely before the Boulevard. So
985-226-0979.
Yeah, that's the the phone. That's my phone. You can send a text. You can call.
Okay.
And then we also have the office phone where you could set up appointments as well.
And what's that number?
That number that's a good question. Let me look at my business card. I never use it.
You don't call yourself and make appointments in it anymore.
Yeah, really. Okay, yeah. Our main office number is 504-889-8406.
And that's Louisiana Rehabilitation and Spine.
Yep.
I
don't know if you could see this on the podcast.
Yeah. Okay. Yeah. Louisiana and Spine, Louisiana. LA Rehab. Okay. LA Rehab and Spine Institute. Sorry about that.
Right.
So LA Rehab and Spine Institute. And y'all can reach him, Dr. Michael, at 504-889-8406. And you can go to 3939 Veterans, Suite 214. Is that correct?
That's correct.
And that's right above Perans. So you can have lunch and get yourself all fixed up right all one place.
Yeah, many people do. Many people are like, oh, good. I'm glad I came. So I go to Prean's today. So
we're got a little deal. Say, hey, you come up here, we give you a coupon to go downstairs.
Yeah, I don't know how Prean's would feel about that one, but yeah, they like their food is good, so they don't like to give discounts so much. But you know,
they've been there. They've been there for how many years? Prean's been in business, like 50 years.
Something like that. Yeah.
He's been around for a long time too.
Right.
Well, Dr. Michael, I'm glad we got a chance to meet with you and learn more about it. It's really intrigued me. I might be coming to you, but it really is interesting and all the different types of things are out there right now that people don't know about. So if you want to learn more, again, you can reach Dr. Michael at 504-889-8406, and that is the LA Rehab and Spine Institute at 3939 Veterans Boulevard, Suite 214. Dr. Michael, I appreciate your time tonight, and I look forward to hopefully getting a chance to meet with you in person.
Be looking forward to it. Thank you so much for having me, Renee. I appreciate your time this evening. And
I appreciate it.
Anytime you want to come in, and in fact, for you, if you want to come in, just check it out. I'd be more than happy to entertain that for you.
Yeah, no, I think we'll probably do more specials on this year. My goal is really just it's informing individuals on different things. We're going through fitness, we're going through health, we're going through wealth, right? And right. It's just different things and different people like Christy, she introduced me to you. And really what Your Passion podcast has really been designed for, bringing people on, getting to know people, because when people get to know you, like you, and trust you, and they start understanding what's inside, because you and I both know that people are passing by you on a daily basis, and sometimes they just don't know what's inside. And right. When they get to know you, That's really what the podcast is all about, is really just to help people get to know who you are and get to know really more about what you do. And so hopefully that's where this will spread. And so I thank you again for coming on and having an opportunity talking with you.
Well, I appreciate your service that you do, because it's a very necessary service, because sometimes people, they get in situations, they just don't know where to go. And right. if they have the information, and you're helping provide that information to people, no matter what they need. And that's a good thing to have. It's very important.
I think that, it's business owners, small business owners like ourselves, is just basically, it's networking, and it's just getting the information. So I'm hoping that we spread the word. We get more individuals subscribed to our channels through the years, and we just kind of get more opportunities where we can help small business owners like ourselves just really get the word out and help each other grow. So I think 2025 is going to be a great year. I think a lot of good things are happening. And so I'm going to be bringing in more different health groups together, and we can kind of start networking more. So I'll be working with Christy and some other people on that, and I'll let you know when we do that.
All right, perfect. Well, I appreciate you. Anytime I do anything for you, let me know.
All right. Thank you very much.
All right. Have a good one, man.
Bye-bye.
Okay, bye.